Hello, and thank you for joining us again today on the studios of Nigerian Television Authority, the NTA. And yesterday we started by celebrating Nigeria within certain departments, the culture, the ethics, and our value. Today we intend to take it all up to the health. Now I'll tell you something that happened yesterday. One of our editors, Ola, I finished from work and I saw him trekking and told me he had trekked for like 2 hours. I was amazed because that's not him. And I asked, why are you doing this? He says he wants to be as healthy as Nigeria gets older. That's very imperative. It is important that our health stay on its A charts if we must get it right in this nation. Again, I repeat, and I know that we all know that already, health is wealth. And we try to ensure that our health, as much as we can, it's as good as it should be. But a lot of times it depends on much more than what you and I can do. Some of them is the policy, some of them is the environment, some of them, is still what other people do when it comes to you. But then at 61, we should be able to have gotten to a certain level. I don't know where we are, but I know I'm healthy now. And our trust for today is to find out collectively, are Nigerians healthy? Could it be better? And how do we go about it? To kickstart this, we'll take a backgrounder, of course, packaged by Francis Ogbe, and that will set us in the right mood for the discussion. Let's go.
From the amalgamation of the Southern and Northern Protectorate in 1914 to the struggle for independence in 1960, Nigeria's journey to nationhood has been quite undulating. However, anniversary is a time to reflect on past years of successes and failures, losses and gains in order to reposition and re-strategize for a better and more desirable future results. How far have we fared as a nation?
The initial hopes, the enthusiasm that greeted our independence was dwindled as a result of so many crises that engulfed this country. For me, I think I'm optimistic that Nigeria is still on the right path. And with democracy right now, a lot of things are ongoing, a lot of reform is going on. There's investment in infrastructure. Of course, we have issues with security, banditry, and so many things, collapsing, institutional failure. But again, when you look at the demeanor of the present leadership of the country, you will notice that they are committed towards nation building.
As a country, we have come a long way in years and strength, and it will not be too much to celebrate the little wins and victories as we mark our independence.
When we're growing up in the whole benders in the Kuruku, county, or I'll call it local government, when we are sick, my mother takes us to the hospital. And when we get to the general hospital in Igara, we cure, we meet other patients, and there are consulting rooms. As long as Igara is not the headquarters of Bendel State, it's a small town in the northern part of Bendel. But we had like 5 doctors in 1982, 83, 84. We have five doctors attending to people on a daily basis from Monday to Saturday. In addition to a primary healthcare that was just around the corner in Akoko and Enwa. So the healthcare system was very strong. We inherited a very strong colonial healthcare system. So what is the problem? The problem was that there's low investment in the health sector. Doctors are not being motivated. In fact, Nigeria practically trains doctors free of charge. But when they are trained based on subvention from the federal government in federal universities, there is no incentive to retain them.
The ongoing COVID-19 pandemic has laid bare gaps in Nigeria's medical and pharmaceutical research institutions. This perhaps shows why the country has continued to live with several diseases which otherwise the country could have gotten vaccines and drugs for. should researchers be well funded?
When you look at the national budget, you look at it very critically. How much is dedicated to even research on innovation and human capital? It's almost zero. And a country cannot move without dedicating a significant portion of its budget for education and social research into basic research and development. Because it is research that will tell you where you are now and where you ought to be. They also come up with indices and data as to what other countries are doing in this particular area. Rwanda is where it is today. Rwanda is one of the fastest growing economy in Africa today because of the amount of money dedicated to research and development. Every country in the world that is doing well, France, Singapore, especially South Korea, when you look at the national budget, you see it there, 20%, 50% dedicated to national research and development.
The use of complementary and alternative medicine is now on the increase. Evidence from studies carried out globally has established that complementary and alternative medicine use is very common and varies among populations.
How much money has been invested in the last 50 years, 60 years to do research on how Africa has traditionally treated themselves when they are sick, when they have high blood pressure, when they have malaria, how are typhoid and all, how have they traditionally treated themselves before the advent of primary health care hospitals and teaching hospitals? Those are the things that don't happen in other countries like China and South Korea and North Korea. They don't joke, they don't discard what they inherited from their forefathers. So I am not going to support that we should discard local or herbal medicine, but what we should do is to regulate it, invest in it, train those people who are practicing herbal medicine, and expose them to hygiene, to modern facilities on how to take care of people, because they are very potent. I grew up in the village and I know what herbs did to me as a young boy that was always having injuries.
Notwithstanding the challenges confronting the health sector, there is a clarion call for all stakeholders to work together towards making our health sector a force to be reckoned with in the Committee of Nations.
The Nigeria of my dream is a country that is fastest growing in terms of gross domestic product, fastest growing in terms of human capital, fastest growing in terms of per capita income. The Nigeria of my dream is a country that will grow at not less than 6% per annum in the next 20 years. And when you grow 6% continuously on a sustainable basis for the next 20 years, you will have ended up lifting over 100 million people out of poverty. And we should emphasize industrialization rather than poverty reduction. I see a lot of emphasis on poverty reduction, but you would fail to understand that when you emphasize poverty reduction, you'll be giving handout. But when you emphasize industrialization, automatically you eliminate poverty and you become a major producer of goods and services. That is Nigeria of my dream.
Our focus on Weekend Deal today will be on Nigeria's health sector 61 years after. How far have we fared? Weekend Deal.
All right, now you know where we are going to. We intend to continue, on the ride, healthy speaking. And for now, we're going to look at the basis. They say charity begins at home. And if you talk about health, the home, the basis is the primary health. What is the status as it concerns the establishment, the practices, the workers at the moment? Let's go and find out what the status of the primary health are in Nigeria today.
Health, they say, is wealth. Hence, the absence of a good health care system becomes a problem in a society.
A healthy nation is a wealthy nation. It's only when people are healthy that they can be productive. And we need productivity to move the country ahead.
Constitutionally, it is the primary duty of every government to provide basic healthcare facilities for the overall well-being of the citizenry.
The federal government has the honors responsibility to provide health for all citizens, Nigerians as well as the state governments. In the concurrent list, you have federal health facilities vis-a-vis state health facilities.
Take a look at the state of the nation's primary health care system.
The system is very poor. So when you want to pay, you stay on the queue, and the cashier is only one, and the system is very bad. Even if you want to take a card over there, the people that are working there, they are about one person using a computer, the system.
The drugs are not there. They are expensive. And when they tell you this amount, at least government, I don't know whether government subsidize the price of drugs. Are you hearing me? So if it comes down for a low man income earner, people won't cry. Nigeria as a nation does not take health as something that is very, very important compared to other things that they do. You find that if you look at the budgetary allocation, what they give to health, you see, it's very small compared to other things.
Nevertheless, successes recorded so far by the Edo State government in this crucial sector are also glaring.
This is Oyoge Primary Healthcare Center, which was renovated and worked on by the Governor Godwin Obaseki.
We have over 500 primary care centers, and we have started the renovation and upgrade of many of these facilities, and we are rolling them over to the next set as we finish one. The next one we also have done, which we have commenced, is the training of the health personnel. So changing their orientation so that they can be more receptive to patients. They can also render basic services. And also we have keyed into the Basic Healthcare Provision Fund, where indigent persons are given privileges of getting free access to healthcare.
What measures should be taken to build a stronger and viral healthcare system?
Employ doctors and nurses, health workers. That is all that we need. We are not crying for too much. Let them just give us good health facilities.
We just recruit health workers into the primary care alongside with other health sector in the state. That automatically increases the manpower.
Expectations are high that the nation's primary health care system would improve exponentially, especially as the nation clocks 61 years of freedom from its colonial masters.
All right, we have joined us in the studio someone you will be needing to ask all the questions that are bothering you in your mind. He is the Chairman House Committee on Health, and he's also representing Ngaski community. And I know him specifically for his work. He is an obstetric gynecologist, and he's also known as Access Health Surgeon. And let me welcome you properly, Honorable Tanko Sununo. Thank you for joining us.
Thank you very much. But
It's
in
always
full,
a
I
pleasure.
represent Yauri, Shanga, and Geski Federal Constituency of Kebbi State.
Okay.
Yes.
So Nigeria is 61 as we speak, just a couple of days away. And we always say that where there is health, good health, there is plenty of hope. And of course, there is wealth to go with it. Do you think, in your assessment, that Nigeria has done well in terms of health?
Nigeria has
done well in terms of health?
Well, thank you very much for inviting me once again. Well, the statement is quite true. Not only prosperous, it's a healthy nation, yes, it's a wealthy nation. That's a statement that has stand the test of time. The question whether Nigeria has done well, definitely you have to look at a lot of issues that you need a concrete data to analyze. But just like any other aspect of human endeavor in our country, data, there's a lot of paucity of data, but you can make also a deduction, which even in scientific arena in medical practice, you can use the experience of a senior colleague. That is, we call it level 4 evidence. So in the absence of other data, we can now use our evidence to say that whether we have gone forward or not. Over the years, if you look at it right from independence, you find that the number of indigenous practitioners are very few. When you look at it now, I'm now talking of human resource for health. To the extent that now, if you look at it, we have so many teaching hospitals within the country. At least we have more than 54 tertiary health institutions. These are institutions that before We hardly see a specialist there. And now you can find that, for example, when I was a medical student, we have issue of lack of specialists in where I was trained. I started my training in Sokoto, so I had to be relocated to Maiduguri. But as of today, Usman Danfodio University Teaching Hospital can boast of more than 200 specialists in different aspects of human endeavor. So this, you can say that we have gone ahead as far as that is concerned in terms of there are many equipment hitherto wasn't available in the country. Just let's say even when the COVID-19 came, we only have 4 laboratories, but as today we can proud of more than 140. That's in terms of this. When you look at the funding that is where much has not been done really, because we have a Abuja declaration that says at least 15% of consolidated revenue funds should be allocated to healthcare delivery services. But up to now, we are opening around 5, 6, not even up to 7%. But however, there is one thing that we must also take of note in this regime that is worthy and very commendable action. That is to say, in 2019, 2020, and even in 2021, the budget that has been allocated to health witnessed 100% release. As of today, we have
100% release.
Release of fund.
Yeah, as against how many percent release in the past?
Prior to now, it usually to be around 40, 50, sometimes 60. But this regime of President Muhammad Buhari, since I joined the National Assembly, we have witnessed virtually in all the health aspect of the allocation has received 100% release. Now, if you say you are giving 10%, and then you follow it with 30% release, that doesn't speak well of the system. But even the 7 or 6% that we are getting 100%. And that means we are not working with a bogus figure like that. It is actual. Because you made a submission, you needed 100 million, and you received 100 million from the federal government. I think this must be commended. And these are the positive aspects of this government that are not being celebrated. So we have to celebrate it. It is worthy of celebration. So it's a step forward. But however, the funding, I said, we still need to make effort at this. If you come also in terms of service delivery, you find that up till now, 70% of Nigerians have to put hand out of their pocket to make their healthcare expenses, which is also not good as far as our world is concerned. But there is also this legislative executive parley. So as we have a very good harmonious relationship to be able to deliver the dividends of democracy to average citizens in Nigeria. And that's why we came up with the review, which is also, I think, it was even, I'm not quite sure, but it's likely to be an executive bill. But I'm not certain whether it's a private member bill or executive bill to amend the act that establishes national health insurance scheme.
All right. Before we get to that,
yes.
National, I think somebody will be speaking.
No, I'm coming. It's just part of the this thing that we want to say. So, for example, we notice that, I'm taking the component one after the other. So I'm not saying the access to healthcare delivery, which the House noticed that the National Assembly noticed that is barely inadequate. Only to say less than 10% of the population are covered. That's not acceptable. So we thought, what was the effect? The reason why we cannot move forward. So we found that it was because the law that establishes national health insurance scheme does not give it the mandate to cover everybody. It concentrates more in formal sector, excluding informal sector. Okay. So we now have to come with amendment, which has been passed by National Assembly, to make healthcare delivery services access mandatory to every Nigerian. And therefore, we define a basic minimum package that average Nigerian should have as a means of healthcare delivery system. So this is also another development that we can go on.
That's good, because I want to see the ordinary groundnut seller in the markets, who goes out and something happens to him or her and has access to health. Where you deploy all of that, do you do effective, monitoring and evaluation?
Yes, exactly.
To ensure that they are used for what they are supposed to be used.
Exactly. I was in Imo State. I was also in Zaria, Kudan General Primary Health Center. We are supposed to go to Jos to assess the same thing, but unfortunately the day we were about to depart, that night there was an episode and there was confusions there. We have been to many states. We have been to Oshun, we have been to Ogun, just to ensure that we detected some issues. And what we have detected is the lack of awareness of the general public those who are enrolled so that they can access that services, and that recommendation has been forwarded to the National Health Insurance Scheme, and I believe the ES and the coordinator of that scheme, they have gone ahead in terms of calling those people so that each and individual person will get his own, as at now, has gotten his own ID card that he can present to the center so that he can access services, or he or she can access services. And I think with that, if we continue to do that, what we are trying to see is how can we say now, yes, access to healthcare has improved.
You know, you will get to that eventually, but I believe in what Nelson Mandela said when he talked about education being the greatest way of acquiring the civilization we are looking for. Education may not just be the formal education; it's in being informed. Now, the ordinary citizen out there, while you're making provision for facilities, people that will be giving them the needed experts in the primary health care services, are we also making provision for education, enlightenment, for the people who do not know? For instance, I'm being told, numbers have been quoted, that cholera is on the spread. And cholera, we know, is a communicable disease. How much effort is being made to enlighten the ordinary citizen on how to stay away, keep away from these kind of diseases? I mean, it's something that we should all think about. Prevention is always better than cure. What's your take?
Well, I think definitely whoever knows how health system is run, it's a multi-sectoral approach. And definitely a key to successful health program is proper health education. Just for instance, I have to rush from Benin City to here because yesterday we observed that despite the fact that there is availability of the vaccine for COVID-19 vaccination, and also the call by Mr. President during the United Nations, that equity should be given to distribution of vaccine so that we can have more vaccine in Africa. We have little hesitancy because of the negative impact of social media toward acceptability of the vaccine. So we have come up with a town hall meeting that I attended yesterday. General public were invited in the government house. They are given the opportunity to raise issues, ask questions, and their fears are addressed, aim at improving their perception.
What I was trying to say, for instance, we have very common places our people go to, gather. And I don't think it would take a whole lot if I send somebody who is knowledgeable, somebody who understands the mouth of the people, go to the mosque, go to the churches, go to the marketplaces, and speak to them in their own language how to take it away.
Yes.
I go to these places and haven't been educated.
You see, that's what I'm saying. That's also ongoing. Mm-hmm. If you look at the state primary health care development agencies of virtually each and every state, is up and doing to ensure that people get awareness. But we also have partnership. The National Primary Health Care and the Nigerian Center of Disease Control, as part of the mandate of their act, is for them to strengthen services delivery in the state and the local government. And they have been doing that. When there was an outbreak, sometimes I have to call the Nigerian Center of Disease DG. He told me, as at that time, to show that we are monitoring, Bochi was the epicenter of cholera spread then, and then he already told me he has already sent his staff there and they are partnering. Not only that, NGO too, the World Health Organization must also be commended. They are up and doing in terms of capacity building, health education and what. So it's as a whole a partnership. But what we are trying to say now, what the view of the House now, is not only restricted to health and health-related department. No, let us give it a holistic approach. Okay. We know that you cannot fight cholera without a proper environmental sanitation. You cannot fight cholera without water sanitation. So therefore, in our own understanding, we invite all those relevant stakeholders to find how do we go ahead. How can we say that average Nigerian in his own village, even if he cannot get it from borehole, he can use hand pump and then get a water that is potable, that is coming from the underground water, that's not much infected.
Thank you, Honorable. Thank you so much for coming on the show. It's always interesting to have a conversation with you. I want to believe, and we'll follow up on that monitoring you're doing, because health, for me, is very important. Once one is gone, there is nothing to talk about anymore. All right, we'll be speaking with the Honorable Member, who is also the Chairman, House Committee on Health. And And you can see that contrary to what some of us may think, there's a whole lot going on behind to ensure that Nigeria at 61 is healthy. Thank you, Honorable Tanko Sununu, for coming on the show.
Thank you, ma'am.
Right now, we'll take a break. When we come back, more is in the offing for you. Don't go away. Okay, so we are talking health, and you cannot speak of health without speaking of certain other things. One of them is research and development. Now, a lot of things evolve because effort is made. Effort is placed in the right orders, and then we get to find drugs and all of that. But let's see the impact of research and development within Nigerian health system so far.
Health is an important indicator to measure development. No society can develop if the health of its population is poor. Therefore, any nation that seeks to develop must pay attention to health issues.
When training of doctors in Nigeria started, they were being sent to the UK, and people then were being awarded degrees of MBBS of London. After some time, government built teaching hospitals in Nigeria. They started medical school, and by 1960 or thereabout, MBBS Ibadan started.
The need to reform the health sector in Nigeria has been a major preoccupation of both the colonial and post-colonial governments. A task undertaking to improve the health and well-being of its population and ensure sustainable development.
I know that those manning the health sector now are professionals. You know, Dr. Hanire, Dr. Mamora, and of course Dr. Ngige is also in government, and then he also, you know, he has experience in health management. So we do hope that this improvement that's incremental will continue. But if we slide back, more people will be dying.
Well, the health sector need more funding.
It might interest you to know that for decades ago, the communicable diseases outbreak was a threat not only to lives of individuals, but also national security. Today, it is possible to track outbreaks of diseases and set up medical treatment and preventive measures even before it spreads over a large populace. Looking at our journey so far in Nigeria, how can we describe our health sector, and what does it tell us about Nigeria at 61?
For us as a nation, that we are still one country, in spite of our differences and challenges, it's worth celebrating, that's one. Now, specifically to the health sector, again, people may want to look at it from different point of views. For me, I believe that if we go back to when Nigeria started and the situation of the Nigerian health system at that time compared to today, we certainly have made some progress.
In terms of medical research here is, for now, I can say it has improved drastically compared to about 6 or 5 years ago. A lot of changes has occurred, and that's why we're able to get this all this equipment I was talking about, the culture lab, the medical synthesizer, the AAS, and so on. So it has actually improved drastically, and the most important thing is the electricity. We have almost 24/7 electricity, and all our freezers, all our things are going perfectly well.
It is a fact that government's performance in the health sector has improved, but desired results have not been achieved.
How much visibility does a country have in terms of the publications that are coming out of research efforts and projects? The citations, how many people elsewhere are using the results of our own research elsewhere to buttress a point that they are trying to make, or that evoke a sense of inquiry in others. And this, of course, go along with goes along with researchers per million population.
We have challenges, and the challenge is actually funds. Our DG has been so magnanimous and been giving us, attracting funds into the institute, but it's not enough. For us to be able to produce vaccine, which a lot of people are saying, what is the institute doing about producing vaccine? Well, we are trying our best, but it might take some time for us to be able to do that.
The workforce in the health sector must have a changed mindset to help the system work well. Also, the government should constantly support and fund research fully so as to make meaningful improvements in the health of Nigerians.
All right, we can't overemphasize the need for research and development if any sector generally must move forward. Some brain has to be put to use, and results brought right out. Now, talking about brains, certain brains came together and gave us certain scheme in 2004. The scheme is the National Health Insurance Scheme. Some people have mentioned it earlier on in the course of a questioning today, and of course the honorable member also talked about it. It's my pleasure to, welcome someone who will be answering the questions directly on that, the benefits and the job and how far so far of the National Health Insurance Scheme here in Nigeria. And he is the General Manager of the Standard Quality and Insurance Assurance of the NHIS, Dr. Yakubu Agada Amadi. And just say good morning to Nigerians.
Good morning, Nigerians.
All right.
Good morning.
Okay, so before I get to ask you the first question, I need you to watch something with me together. All right.
It is important to get health insurance cover that will suit your healthcare needs. With the existing number of health maintenance organizations in Nigeria, signing up for a provider might look easy. But without understanding the different types of health insurance options, it can be a daunting prospect. In December of 2020, the National Health Insurance Scheme, NHIS, launched the NHIS Under One Roof, which is an initiative for effective integration and coordination of health insurance activities in Nigeria towards the attainment of universal health coverage in the country.
As I speak now, the programs of both the National Health Insurance Scheme and the State Social Health Insurance Scheme is becoming very impactful. Quite a lot of Nigerians are already, feeling the effect of this synergy. And I think it's a way forward to help the healthcare system in Nigeria. The population of those that are enrolled now is rising steadily, and I'm sure very soon we are going to reach the El Dorado.
Although there are both public and private healthcare providers, some registered participants believe that the NHIS implementation in Nigeria is doing its best, but the coverage is skewed and inequitable, especially among the informal sector.
We, the beneficiary, we are really enjoying it. It's helping. If you go to their pharmacy, there are some drugs that they say NHIS has not covered. If you go to dentist, they will tell you there are some teeth that NHIS has not covered. So these are the challenges, limitations we are facing.
They are working effectively, but just that in some areas, like when you go to some hospitals in the hinterland, you may not really experience or the presence of insurance health scheme.
They should try and sensitize the locals, especially in the rural areas. Because I know for a fact that my mother-in-law wanted to do the sun, but she was having problems doing it. I don't know if she even ended up doing it. The National Health Insurance Scheme. So the rich, and make it more accessible.
There's what we call the benefit package, which is clearly stated in that document what is covered, what is not covered. However, some healthcare providers can be very mischievous. You go there and they say, no, this is not covered, that is not covered. That is not exactly the truth. So you have the benefit package. For example, in FCT now, we have mass-produced the benefit package to be given to both the healthcare provider and our enrollee, so that everybody knows what is actually truly covered and what is not. But however, I will not be surprised if some hospitals are actually doing the wrong thing. For example, in FHIS now, we are trying to put our own desk officers in all of the hospitals, so that when the enrollee from insurance is moving around, there is a staff of the agency, not the staff of the hospital, who is monitoring this.
So you can go now. Try your slippers. Next child.
Healthcare services of contributors are paid from the common pool of funds contributed by participants of the scheme, allowing the healthcare maintenance organizations, HMOs, to pay for those needing medical attention.
Okay, now we saw that bit, so we'll be having our full conversation now with Dr. Yakubu Agada Amadi. And once again, you're the General Manager, Standard and Quality Assurance in HNS. Okay. All right, now, Nigeria is stepping into the grand age of 61. It's a big one. But we'd like to know, things that are happening within our health sector, and specifically the health insurance established to 2004. How far has it gone to benefit Nigerians as of today?
Thank you very much for having me. The National Health Insurance Scheme, like you rightly said, started enrolling the federal civil servants in 2005. And since then, we have enrolled almost all civil servants, all federal civil servants in Nigeria. We have tried to provide the benefit package that we have contracted with Nigerians to provide to those who are enrolled under the scheme. So far, so good. We may not be where we want to be yet, because the idea is universal health coverage. We want every Nigerian to have a health insurance policy. That hasn't happened, but we have made progress since 2005. We've been able to provide the services that we have contracted on behalf of our enrollees with the health maintenance organizations and healthcare facilities. And so far, so good. We are doing that. We are doing a lot of innovations in the scheme right now. For the first time, under the leadership of Professor Mohammed Nasir Sambo, the Executive Secretary, we've been able to have a 10-year strategic plan for the scheme, and targeted towards enrolling every Nigerian under the scheme. We have the 3-point rebranding agenda, which is a clear departure from the past. We are now focused. We are building capacity. We are building all the resources that we need. We are pulling. That's what we are doing. We are mobilizing revenue, pulling resources. And we are strategically purchasing, we are reviewing our tools, and we are doing a lot of things towards the march, towards the universal health coverage for all Nigerians.
You're doing a whole lot from what you're saying. Are you also including the mass education of people? Because a lot of people, even the people you say you have enrolled as the federal workers, I don't know how much of your services they know about. Is there any mass enlightenment on what you represent in their lives with regards to their health?
Yeah, so like I said, is a new whole push that we are doing, a lot of innovations. And part of the 10-year strategic plan is also look at mobilization, sensitization, advocacies, and all that. They are all incorporated. But right now, yes, we are doing a lot. Our website has the benefit package. We have booklets for the benefit package that is covered under each of the programs that we give to our enrollees. And we have call center numbers that we encourage our enrollees to call freely whenever they need to.
They have issues.
Yes, they have issues.
Okay, that's good. I also noticed somewhere in the internet you had a particular number I can use to check my status, hash something for any network. How does that work? If I need to check my status, I don't know if it's here. I should dial *929# to all network. Does that work to check my status?
Yeah, so it's part of the whole ENHIS plan that we have. Very soon, people who are enrolled under the National Health Insurance Scheme will be asked to go and update their status so
Online.
that online, so that you can do a lot of things. You can see, you can even change your healthcare facilities at a point. The Federal Executive Council has graciously approved for NHIS the eNHIS project. And that is going to take care of all that, so that you don't necessarily, if you want to add a dependent, like you have a new baby or you get married and you want to add your dependent, you don't necessarily have to go to NHIS. You should be able to do some
Everything
of those.
you want to do
yes,
on your own.
on your own.
At the comfort
So
of your home.
that's
Okay.
where we are going in the next few months. We should be there.
Okay, that's interesting. Some people, told us they encounter when they go to certain hospital is some form of do I say non-preferential or preferential treatment. When you say you're paying with NHS, some people kind of look down on you. And I try to ask questions. Some of the hospitals say it's because their money is not easily given back to them. How real is this? What's going on?
So I wouldn't sit down here and say the hospitals are wrong. We have had those complaints and we are working on it. We are sanctioning HMOs, we are sanctioning healthcare facilities that are refusing to offer services. One of the things that have been done recently too is the issue of recovery of debt owed the healthcare facilities by the health maintenance organizations. At the last count, we've been able to recover over 2-point-something billion for the healthcare facilities through the interventions of NHIS. That is ongoing. And I think that's why I said I didn't want to sit down and say what the healthcare facilities are doing is, what they are saying is not correct. They may be right, but what we have always said is that the enrollees of NHIS has already paid ahead. It's called prepayment. They paid ahead for their services. And they are not interested in all this payment and all these things. But the hospitals also have to survive because they have to be paid for the services that they offer. Some they are paid ahead, we call capitation. Some they are paid in arrears, which we call a fee for service. So we are on top of it. Recently, we've made some reforms too, where we are decentralizing a lot of the services to the state offices. We have state offices in all the states of the Federation. So we have also tried to build capacity at the level of the state offices with medical personnel to be able to quickly dash to the hospitals and the health maintenance organizations and be able to make them to reconcile bills, to monitor the quality of care that is being offered at the level of the healthcare facilities. So a lot of things are going on, and I am very sure that we are putting together a very big package for Nigerians as we attain 61 years of nationhood.
Interesting. Yeah. And as you do that, I can assure you that our big eye is also on your big package to see how much of the spread.
We welcome that any
You
day.
welcome that. All right. Now, you spoke about the states. I'd like to know, what's the state of enrollment of state workers, because they too are Nigerians and must benefit.
In about 2014, 2015, NHI submitted a bill to the National Council for Health, which has approved the decentralization of health insurance to the state. So every state in Nigeria enacting laws, there are various levels of operation, of implementation of health insurance. The state health insurance, the state civil servants are going to be covered under the state social health insurance agencies.
Are going to, so it's not yet done.
No, many of the states, I'm coming to that.
Okay.
Many of the states like Kano, Delta, I think Lagos, are already capturing their state civil servants. They are also going into the informal sector through the basic healthcare provision form and other forms of innovative financing they are able to do. So that is already happening at that level. Many of the states are at different level of implementation. Some are already providing access to care. Some are at the point of registering. Some are still trying to build the structures, the organizational structures for the health insurance. But by all means, I think at the last count, all the states in Nigeria have already enacted laws for health insurance.
All right, let's interact with our audience a little bit. Somebody is writing in here, it says from Kano. Sir, I am not satisfied with my hospital. They do not treat us well. I wish you stated the name of the hospital here. How do I change to another hospital?
If it's an enrollee of NHIS, you should go to the NHIS office in Kano and change the facility. That can be done easily. Once you have not changed your facility for the past 6 months, you are entitled to change your facility.
But talking about change of facility, I've been reliably told by one or two persons that it takes a longer time to change facility. Can I just carry the paper from here to here? Why does it need to take like 6 months?
So what is happening is the HMOs are helping us collecting data for change of facility. Before now, it was done manually. But the intervention we have done, so it's going to be faster now. But before now, you need to fill papers and then they take it through the zonal office to Abuja but right now they have access directly to the database, so they are able to quickly change.
That's a good one for you.
Thank you, ma'am.
Thank you very much. We've been speaking with the General Manager, Standard and Quality Assurance in National Health Insurance Scheme, Dr. Yakubu Agada Amade. Thank you for coming.
Thank you.
You just said something. I needed to know specifically what is included and not included. But you tell me today that there is a booklet. It's on your website, and that much more later I can also have access to that because I'm an enrollee. So I look forward to that booklet, and maybe once again we'll call you to find out why are certain things not on the exclusive list. We're going to be talking a little bit with a specialist within that department, that's the alternative medicine. And so I have in the studio Dr. Susan Adams, the CEO, founder of, she's also a specialist, Center for Lifestyle and Preventive Medicine. Dr. Susan, I know that you have a master's degree in health management, specialist in lifestyle medicine from Harvard University, and you also have a doctorate degree in pharmacy. Yes, you're welcome to the studio.
Thank you so much.
I'm wondering, medical doctor, pharmacy. So how did you jump into
this doctor? Well, I actually say my nickname is Dr. Susan.
Okay.
And growing up as a child, I've always had passion for healing. And yes, my mini story goes that, you know, we are busy people, and I grew up in a busy household. My mother, when she was retiring, she became a diabetic, and my dad developed hypertension. Yes, so I actually got accepted into both a pharmacy school and a medical school. My dad said, go to pharmacy so that you can go and get that one drug and come and cure these diabetes and hypertension, so that we'll be okay. Yeah, so that's how I ended up in pharmacy school first, but I kept furthering. I have a master's, I have a doctor of pharmacy degree, and then I also did an MBA, then I did master's in health management. I love school. I'm research minded, so that's where the doctor comes in.
How do you see Nigeria? How have we been able to project, in terms of alternative care here in Nigeria?
Oh, it's a tough one. For me, I feel that every Nigerian is practicing self-medicated alternative care, because you go maybe to your village, they bring you coconut water in a cup. When you drink it and you say, this is healthy, what is that?
I'm going to offer you mangading egg. That's my alternative.
In fact, it's one of the best for diabetes, actually. You know what I mean? So I feel like we are doing that. Now, what we are seeing now is that, let's say you have diabetes, you will hear somebody saying, you can drink bitter leaf and the diabetes will go. And then people will start drinking bitter leaves. I'm sorry to say, some of them, they ruin their health. Yes, because some of them, they may have already been on orthodox medicine. Maybe their liver is compromised, kidney is compromised, etc. So me, I'm more of the side of medically guided wellness, whereby, okay, you want to go and take these alternative things, see your doctor, let your doctor let you know that you qualify to take alternative drugs. I feel like that's where I am. And I'm also very happy with, I would just jump in with the government, because I found out that in the Federal Ministry of Health, there's a department just established recently called TCAM, Traditional, Complementary and Alternative Medicine. So where they gather all the traditional medicine practitioners and train them on maybe how to bring hygiene into the equation, how to tell them don't run away from your doctor, like that, because I attended one of their trainings. So
how
that's
has
where
this
we are.
synergy helped Nigerians?
You mean synergy?
Between the alternative medicine and the orthodox
medicine? Well, you know, medical doctors, pharmacists, nurses, they don't teach alternate. I've been through a pharmacy school. I've actually been through medical school, because the Harvard program, the lifestyle medicine, was in Boston, in Harvard. So I'm also a clinical pharmacist first. That means when you finish your pharmacy school, you work more in the hospital. You're a clinician. You work as a team. The synergy is not there too much. It's not there. But I feel like lately many doctors are actually embracing it.
No, I want us to go back. You say you're research based.
Yes, I am.
And in Nigeria, a lot of things have trended. They may not be, or they're not very medically okay. We have had the Ebola. We've had the Lassa fever. We still have the malaria, cholera, and quite recently COVID-19. How has what is the alternative medicine doing to ensure, for instance, I have malaria every 2 weeks. There's something to be done by way of vaccination for malaria, for cholera, for even COVID-19.
Okay, so your question is, what is alternative medicine bringing to the table on the subject matter? Well, you've heard of things like steam bath with leaves.
Steam bath with leaves?
Yes, with leaves
really?
like neem leaves and pawpaw leaves and all that. People are practicing it and they say it works.
So how do I know I am not oversteaming so I don't burn my skin?
See, that's the problem. This is where medical pharmacy have a problem with alternative. I'm sorry, I have to say it like it is. You see, you can eat this garden egg. It's good for you. Another person will eat it and have bloated stomach. Or maybe allergy. So when you're going into natural and alternative medicine, one result for one person may not be exactly for the other person. But then what we are noticing is that if it worked for you, you start screaming, oh my God, drink this, it works, bring this as well. So I'm actually in a very funny position, because I'm the medically guided alternative medicine practitioner. Now, when I said research-based, is that, okay, there are data to prove that turmeric is an anti-inflammatory. Data online, studies, evidence-based, then we can prescribe turmeric for people who maybe have allergy to aspirin or GI issues, etc. There's data to show that bitter leaf helps metabolism and in diabetes. Then we look at your body, then we say this. So then we are documenting the African experience in using traditional medicine, so that this evidence-based and data thing will come out and people can say, okay, there's a place where they use this consistently over a year. this is the same result. See, that's where we are lacking, and that's where the medical practitioners, I believe, have a problem with just saying, go and do what you like, because you can't dose. Nobody's, really, really paying attention. Well, people are paying attention to that now than before. A lot of people. During the African Traditional Medicine Week, they had a 3 days where Farm Zainab called every traditional medicine practitioner, the ones that she's gotten a hold of, brought everybody. There were hundreds of people. And then she told them, don't hide your recipe. Team up with government. Get yourself listed with. And then brought other people that have registered these products. And then showed everybody how it is done. So I feel that we are actually getting somewhere.
Okay, that's interesting. Now, I'd like to know, Nigeria, you already noticed, pointed out that we're stepping into celebrating our 61st birthday as a nation.
Yes.
On a parting note, really, what would be your advice to Nigerians with regards to lifestyle, which, of course, you are an expert in, our lifestyle and good health?
Okay. So, I'm a lifestyle medicine practitioner, and lifestyle medicine means that your very lifestyle, it's your medicine. See how nice and tall you're sitting?
Oh,
yes.
Did you say that? Nice and tall?
You strengthening that like that? Yes, it's a form of medicine. Taking deep breath is a form of medicine.
Deep breath?
Yes. When you drink water, are you seeing water or are you seeing medicine? Because dehydration, some of us, we are dying of dehydration, not that we are sick. You get a headache, you say, oh, paracetamol, but maybe you try 2 bottles of water, dehydration goes, and then the headache would go. The food you eat, are you eating medicinally? Every time you take your hand to your mouth, are you healing yourself or killing yourself?
Wow.
Yes. And then also rest. Are you sleeping? So I feel like as a lifestyle medicine practitioner, we teach lifestyle medicine, and then we now teach people that when you go back to your kitchen should be your home pharmacy. Your water should have a meaning to you. And I feel that if we Nigerians start there, just being health conscious, I think we can go very far.
Definitely. And what you think can also influence you. Am I right?
Yes, of course.
Think positive.
Yes, there's an aspect of your mind as medicine.
Okay.
So a good mind too, it's medicinal.
All right. Everything about us is medicine, as I've just been told this morning. Thank you, Dr. Susan Adams, for coming on the show.
Thank you so much.
And continue to do well. I know that by the time Nigeria turns 62, more would have come from your stable. And so we've been speaking with the CEO, founder of the Specialist Center for Lifestyle and Preventive Medicine here in Apo, and she's told us a whole lot. Whatever you do, everything about you is your own pharmacy. I just learned today that my kitchen is my pharmacy. Yes. One who never gives up. And that's the story of every Nigerian. We must not give up. The country is ours. No matter what you do, there's no other place to go to. And the good thing is the country is making this prospect for a whole lot of things for all of us. Let's join us again next weekend when we'll bring another sector, for analysis and the journey so far. The program is Weekend Deal, and I've been with you as Elizabeth Abai. Be good citizens.